Hi.
Thank you, Morgan. It is 6 o'clock, so let's get started and we'll continue to admit people as they might be joining in. And welcome to what hiring managers look for in an ideal OT candidate. I put OT in parentheses because when I started doing this presentation, this is very applicable for physical therapists, SLPs. I even shared it with my college senior son that's trying to get into PA school, and he thought that it was very beneficial and informative. So welcome to all. This is brought to you on behalf of the TNOTA Student Involvement Committee, as well as our mentorship committee. We're doing a collaborative event for this. If you'll remember to stay on mute for right now, we will try to answer questions at the end, and you can unmute yourself. Camera's optional, whatever you feel comfortable with. The meeting is being recorded. So if you lose power or connection, I know there's some bad weather moving through the state. This will be available on our TNOTA student webpage on the website. Let me tell you just a little bit about the Student Involvement Committee, and then Logan's going to share a little bit about the Mentorship Committee. So our Student Involvement Committee involves all the OT and OTA students from all across the state. We do these virtual student chats. We also have some social media opportunities where they can take over for a day or look at a day in the life of. We've had a recent student video contest, which has been amazing, and you'll get to see some of those videos if you haven't already seen them at the annual conference. We do have a student lounge at the annual conference and a ton of student resources. If you haven't checked those out on the TNOTA webpage, please do that. They are wonderful. Morgan Webb, who is on the call and also helping, has compiled most of those things. So I want to give her credit for that because it's the most beneficial and informative student website of all the programs throughout the United States. I know because I read them all. I checked them all. So I'd like to invite Logan to speak for just a moment about the Mentorship Committee.
Thanks, Jennifer. Like Jennifer said, I'm Logan Herndon. I am one of the mentorship committee members, and I just want to tell you guys a little bit more about our mentorship program. We are currently in the 6th cycle of the program. It runs from February to November, so it's a 10-month program, and we offer one-to-one mentorship pairings. Currently, to be a mentor, you have to be an OT or an OTA with at least 2 years of experience and an active Tennessee license. And then to be a mentee, you have to be an OT or an OTA with an active Tennessee license, or a student who is at least in their 2nd year of their program in Tennessee. So basically what they do is we ask participants to set goals at the beginning of their mentorship pairing, and then they meet monthly to discuss various topics and work toward those goals. In addition to that, we offer goal setting templates, monthly lesson plans to fill out, and then a list of suggested topics to kind of guide those pairings for those 10 months. And then at the end of the program, we ask that people complete a survey just to help us continue to improve the program, but you also get a certificate of completion for completing the program. And then OT practitioner mentors can get continuing education credit for mentoring other OT practitioners. In addition to some of those things, you also get to build professional relationships. And then we have been offering 2 CEU events every cycle. So this is one of our CEU events for this cycle, and then we're going to offer another one in the fall. Thank you, Jennifer, for putting this together and letting us be a part of this awesome speaking topic.
Thank you, Logan. Before I advance the slide, I want to tell you how this kind of came about. So we do have the quarterly virtual student chats, and the last one that we did was on a resume workshop. Our Student Involvement Committee co-chair, Dr. Taylor Kozel, presented on that. If you haven't seen it, please look at our website. It is so informative, so good for students as well as practitioners that are looking to make a job change. And then the one before that was a practice panel of new OT practitioners. And so I was approached by the mentorship committee to do a CE event for new jobs and interview processes. And so I was thinking back to what we had done in the past 2 times. Thank you, Morgan, for dropping that in the chat, the link. And I thought, why don't we interview hiring managers themselves as opposed to interviewing the new practitioners and seeing what they are looking for? So I hope you find this beneficial, informative, and let's get started. So this is a little bit about myself. I've been practicing for about 28 years, and I do own a private practice with my husband, who is a PT of over 30 years. So between us, we've got a whole lot of experience with interviewing and new hires and things such as that. And I'm currently an adjunct professor also at UTHSC, and I still treat kids at a private school. Here are some of our learning objectives for the evening, and there are CE credits that are optional for this. Hopefully those practitioners that needed those registered for those. But what I want you to be able to do is to be able to identify the platforms that hiring managers use to advertise for job openings. I want you to know what could be considered a red flag in a resume, and be able to describe ways to obtain experience in a new specialty and recognize some of the qualities of an ideal long-term employee. So let me tell you about how we did this. The mentorship committee gave me some questions, and I compiled those with some questions that I had, and I sent them to 39 different hiring managers or rehab directors or clinic owners that are around the area. Most of them were Tennessee. I do have one respondent that was from Alabama. I gave them about 2 or 3 weeks to complete the surveys, the emailed questions, and I got 14 responses. So I think that was a pretty good response rate for that. We have a good mix of the different practitioners that are represented here, OTs as well as PTs and SLPs. I did tell the respondents that they had the option of giving me their name or not, and they all chose to give me their name, and so they will be recognized at the end of the presentation. But I did tell them that I was not going to pair their name with their specific answers. So just keep that in mind, and I will tell you that it was very, very candid. A lot of the answers are very candid. So while we are fixing to delve into the different specialties represented, if you are a mentee being mentored in the mentorship committee with a TNOTA, if you will drop in the chat what your specialty is. I will say that I've practiced in pediatrics for the last 28 years, but I tried to get a lot of different specialties that were represented in this, so it wasn't just pediatric. And also, if you're a mentor, if you are mentoring somebody in a specific specialty, you can drop that in the chat as well. I will say there's a wealth of experience represented with these specialties. One of the participants is over 30 clinics in the area. So let's look at the specialties. So we've got pediatrics, geriatrics, adult acute care, outpatient ortho, hand therapy, inpatient rehab, and early intervention. So you can see there's a wide variety: pediatrics, adults, older adults, a lot of different things that were represented. Next, let's look at some of the platforms that those hiring managers use for job openings. The most frequently used one was Indeed, with about 70% of respondents indicating that they used Indeed for advertising for job openings. LinkedIn was about a fourth. Close to 50% use social media. Business websites were a little over a quarter, word of mouth a little over a quarter, and then other professional organizations such as TNOTA, the different school programs, and Glassdoor. If you're a therapist and you have looked or advertised for a job, in any of these platforms or any other ones, if you'll drop it in the chat, especially if there's something different that I am missing. I feel like this is a pretty good representation. I will say in the new OT practice panel that we had last fall, I asked the practitioners how they got their current job, like right out of school. And I will say just about every one of them said that they got it through a fieldwork rotation, either a level 1 or a level 2. So I feel like that's very important to make students aware of, as well as our fieldwork coordinators. So our fieldworks are super important. Indeed, LinkedIn, fieldwork rotation. Yeah. Thanks, Jenny. Indeed. Yeah. So let's look at some resume strengths. And again, I want to plug Dr. Kozel's last student chat on resume building and a resume workshop. It was interactive, live, real time. It was wonderful. So please check that out if you haven't already. And this is going to go through some of the things that she talked about and then some other answers that some of these respondents gave. So some resume strengths that were noted was having volunteer work, especially in that area of practice, being involved in your professional organizations, such as your TNOTA, having fieldwork experience, or having pertinent experience in that specialty area of practice. For example, if somebody's wanting to work in pediatrics, but they might not have had a pediatric fieldwork experience, maybe they worked at a daycare. Or if somebody's looking for orthopedics, maybe they worked as a rehab technician in earlier days. Having pertinent CEUs in those areas. And while we're on that topic, if you have attended any great CEUs, if you remember any of the companies where you got your CEUs from, if you'll drop that in the chat, and then I'm going to mention some in just a moment. Having leadership or supervisory roles, longevity, having a longevity at a place of work, and extracurriculars. So yes, Aspire OT is one, TNOTA, AOTA, MedBridge, PC, Summit, VHSF, I believe is the one that has some hand therapy, OT.com, occupationaltherapy.com. Yeah, thanks, Morgan. So there's some of these that are, done live, some that are done asynchronous, some that are done synchronously. So those are some of the different strengths that are seen in resumes and some different places that you can get continuing education. So looking at some resume red flags, the first is typos. And I'll tell you a funny story, and I don't know if anybody picked up on it in the last week, but the TNOTA made a social media post for this presentation, and it had spelled careers wrong in it. And the person that did it apologized to me, and I laughed and I said, well, you gave me a great example to talk about how it's so easy to make a typo in your resume, especially if you're the only one that's reading it and your eyes kind of scan over it and fill in the blanks. And sometimes we don't catch our own mistakes. So it's important to have somebody else maybe eyeball. Rachel said that she had her own name misspelled once on her resume. Yes. And then, our spell check's not always good, for grammar types of things. If you're using there and it should be the other there, or, something like that. Poor grammar, frequent job changes that are more like unexplained. Not like if you've had change in your life or having to move or your spouse or partner is moving, but having frequent unexplained job changes in a short period of time and having several jobs in a short period of time. One of the respondents mentioned to me that she always looks for the OT's license number on a resume because she had one at one time that did not put her license number on the resume, and it turns out her license was suspended. So I thought that was interesting. So let's lead into the next interesting topic. How important is the level of degree? And I will say this question more specifically pertains to the occupational therapist versus OTA, and it's looking at having an OTD degree. So you can see in the green chart, it's 100% of the people that responded to this survey said that having an advanced degree does not matter to them. Some of the comments, they don't have a preference in MOT versus OTD. Level of degree is not important. They don't place much value on the level of degree. I will say that I did not interview anybody in academia for this or anybody in research for this. And really, I don't think of any of the respondents were working at a public school hiring level. Because I will say that when I was getting my post-professional doctorate, some of my colleagues in the cohort, they went on to get their doctorate so that they could get more pay in the school systems. I don't think that that happens around here, but I think in some different geographical areas. And I think one of the reasons why these hiring managers said it doesn't matter is because insurances do not reimburse differently for a BS and OT, for some of us old school OTs, an MOT or an OTD. They all reimburse the same from my experience. One of the respondents said that they cared more about work ethic, interpersonal skills, and how they connect with patients. And one PT, and she's referring to DPT graduates, said that she's actually seen an overconfidence in the DPT new graduates since they switched to a mandated doctoral degree, that she's seen a little bit of an overconfidence in some of those new hires. So I thought that that was interesting. So now let's look, how do we gain experience in those specialty areas? So here's some of the ideas that those respondents gave. Job shadowing, again, the CEUs, the continuing educations, mentoring, having volunteer work in those areas, PRN work. And I will say that working in pediatrics, it seems to be a sought after specialty area of practice. And I have had people that have wanted to get into pediatrics come and work at some of the clinics that I have worked at, either like in the evenings, like taking those late afternoon appointments, which I will say in an outpatient pediatric clinic, those are the most sought after appointment times anyway. So a lot of pediatric places might be very willing to hire you from 3 to 6 or something like that, or even weekends. So looking at those PRN options. Some programs have an onboarding program for their new hires and new graduates. And a couple of people mentioned working at a hospital-based or a larger facility first in order to gain more experience and getting to see a lot of different things. And some of the same people said that they also recommended it because it could be a good salary position for new grads that might need benefits or the full-time salary, and to get experience on the acute care side. Now looking at some of those positive qualities of a job interview, being flexible, being genuine, having a positive attitude, being coachable and open-minded, having a sense of humility, and being aware of your weaknesses, asking insightful and thoughtful questions, being ready to grow, having a positive personality, communication skills, being professionally dressed, being punctual, being eager to learn. And also mentioned was if you were doing a virtual interview, to have a neat and tidy and presentable background. And one of the respondents gave this beautiful answer, and I liked this so much. She said she loves it when someone shares a story of how they made a difference in a patient's life. And I also heard having a balance between confidence and not arrogance. So I felt like that was important in having good clinical reasoning skills and problem-solving skills. So looking on the other side, some of the weaknesses mentioned in job interviews are negativity towards a previous employer. I will warn you, the therapist community is very, very small. Um, it doesn't bode well if you speak negative about a previous employer, whether the person you're interviewing with knows that person or not. Um, you might explain why a certain place wasn't a good fit, or looking at what types of things that new opportunity offers, like, oh, I really like the way you go into schools and do developmental screenings, or that you're doing community outreach. That's something that I really wasn't getting at my last employer. But not being negative. Some other weaknesses: not being on time or rescheduling your job interview, being dressed unprofessionally, seeming to chase a paycheck and only asking questions about compensation, not being able to answer questions about themselves. Um, Social media red flags. I will say personally, that I know of two therapy types of candidates that have not been hired specifically due to social media um, red flags. And then having an overall careless demeanor. I will give you a caveat, a warning on this. These respondents were very honest with these answers, and some of them might be a little surprising. But I wanted to tell you their words and explain these. And this is going to go on to the next slide too. So some of the biggest complaints that these hiring managers had about newly hired therapists: wanting or expecting a leadership position too soon, which that's interesting. I hadn't thought about that, but I can understand wanting, to chase the leadership position without having the experience to back it up. Expecting a full-time salary when not working full-time hours. Don't like paperwork, difficulty juggling paperwork. I heard that one several times, and that probably leads into the next one, having time management difficulties. Overall, having a poor work ethic, not asking questions when they should. One of the respondents said that she's had 3 different new hires that waited until they resigned in order to say they needed help. So making sure to ask for help when it is needed is very important. A couple of respondents mentioned having a lack of knowledge about the cost of care and reimbursement. And I'll speak to this just a little bit with understanding the cost of care with having a private practice and worked in a couple of different settings. Some people explain, yeah, they're so interesting. Um, some people expect, like, especially like maybe PRN, but a very big salary. And I will say, working in a private practice clinic, especially, some clinics are reimbursed less than others. If you are privately owned, you are reimbursed at a lower rate than somebody that might be hospital based or working under a physician's clinic. So if you see a client like 1 an hour, for example, in a pediatric setting, insurance might only reimburse the clinic $55 or $65 a session. So if you're a therapist thinking you're going to be making $50 or $55 an hour, there's no way, like in that situation, that would happen or would be financially beneficial um, for the person on the clinic side as the clinic owner, because they also, not only do they have to pay your salary, they might have to pay rent. They have to pay for malpractice insurance. They have to pay for insurance for the building. They have to pay for cleaning. They have to pay for a documentation system. They have to pay for all those test protocols that you use. There's a whole bunch of other costs to factor in. So that's my little plug, my little soapbox about especially working in a private practice. While they might not pay as much as somebody that might be in a bigger setting or under a physician or even not for profits, they might pay a little bit more. So let's continue. Any thoughts on any of those? Taylor said that these are so interesting to hear. Yeah, this was probably my most interesting question, I think. Any other thoughts as we move on to the second page? So we're going to keep talking about some of the biggest complaints about newly hired therapists, not being overconfident or arrogant versus having no confidence in their abilities. So somehow finding a balance in between those two things. Um, Not taking initiative, difficulty handling stress, entitlement, and not being team oriented. Any other thoughts on any of those things? Anything that you are especially surprised about? Things that you didn't realize, things that you didn't think of?
I'm surprised
Yeah.
about
Mhm.
not being, I'm sorry, I didn't raise my hand. I
No,
apologize.
that's fine. Go ahead.
I think I'm surprised about not being team oriented. I'm very surprised by that one because
Mhm.
we've been taught to, have collaboration, with
Yeah.
the others. So I'm really surprised by that.
Yeah, and that was just one person's answer. That's not something that everybody gave. That was just one person's answer and one person's experience. And it might not be an OT manager that is responding. It might be a PT manager or an SLP. So keep that in mind. But yeah, I agree, especially in our OT programs. I feel like they really stress collaboration and being team oriented, and more so than some of the other professions. Thank you for sharing. Any other thoughts on that? So let's now look at one desired skill that new hires lack. So that's what these hiring managers were asked. What is that one desired skill that new hires lack that you want to be able to see? One of the answers is being able to articulate evaluation results and treatment plans to caregivers. And I will say, I have seen this with some of the new practitioners that I have worked with. That is one of the hardest things that some of the newer therapists have. Going on when they first start working is being able to converse like with the caregivers, with the family members about the treatment plan and evaluation results and being able to explain all of those types of things. Critical thinking and problem solving in real life situations. And again, these are singular answers, most of these by singular people. So just keep that in mind. Again, billing competence and billing ethics, communication, communication, communication. That was mentioned several times. And it's not so much as trying to avoid conflict, but being able to handle conflict and communicate that in an appropriate manner rather than just trying to avoid conflict at all costs, because sometimes you do need to speak up and to communicate. But I had a couple of people say that their new hires say, I don't like confrontation. um, Time management again, and that probably also leads into some of the note completion, initiation, resilience to adversity, and engagement or investment in their own career. And qualities of a successful new employee. What do these new hires recognize in some of their successful new employees? So being willing to ask questions and to learn, the ability to problem solve and make those decisions, being team oriented, taking responsibility for their own growth, having a positive attitude, being willing to seek out knowledge, and being a leader, and an untitled leader. So even though they might not be given that specific leadership role, being an example to others, being a leader in all situations. Some other things that were mentioned was staying humble, genuinely wanting to help their clients and their coworkers, being able to recognize their knowledge gaps and be able to seek out help in those areas. So now I'm going to talk a little bit about what these candidates mentioned, or what these hiring managers mentioned that how they measured success in a new therapist. And these are more cut and paste. These answers were so rich, I didn't want to take anything away from them. So I just kind of cut and pasted them. You can see my little organizational system. I had everybody in color, so that wasn't matching up names with answers, but just kind of organizing them that way. So let's go through these, and then we'll talk a little bit. We're right at 6:30, so we'll have some time to discuss. How do you measure success in a new therapist? And the one says they do frequent observations, looking not only to follow standard procedures, such as documentation and safety types of protocols, but also comfort and confidence in their abilities and knowledge, balanced with the humility to ask questions and learn from others and to deepen their knowledge and improve their skill set. Next, how much families like them, how willing they are to ask for feedback from experienced therapists, being on time and not taking off all the time, even if it's unpaid. We look at how well they connect with patients, how they collaborate with the team, and their growth over time. Are they improving in clinical decision making? Are they open to feedback? Are they showing progress with time management and outcomes? If they're committed to learning and improving, that's a success in my book. This answer was very specific. It sounds like somebody that's, a hospital-based person, but they measure quantitative and qualitative data. They have two metrics of productivity that they track: patients per hour and billed charges. Upon conclusion of the provisional period of 3 to 6 months, new hires are expected to meet both of these numbers. We will also conduct chart audits to check for the quality of the documentation. They conduct competencies to ensure staff understands lines and tubes and drains, oxygen, DVT, PE protocols. Each new hire is paired with a mentor who helps facilitate the orientation process. I feel like this one was probably one that was the most detailed and had something very specific. Independence in a caseload with only basic supervision and a willingness to ask questions when info is not known is very important. Being active and ongoing for pursuing education to help their patients, asking questions. You cannot come out of school after studying for boards thinking you know everything. They know the basics. They do not understand how much they do not know. We start them on a reduced schedule to allow time to implement treatment strategies and get familiar with the software systems for notes. So success is taking on these projects with enthusiasm and progressing quickly through the process. Once we establish their competence, we have specific targets for patient visits, units performed per treatment, and proper progression of treatment plans. Simply put, how they treat their patients and respect is earned based on those outcomes. Someone who takes time to learn about the things they don't know, growing in therapy skills and communication interactions with patients, and growth in the ability to interact with authority in a workplace. Asking questions, maintaining and growing their caseload, contributing to discussions in and around the clinic, a willingness to work as a team, growth in identifying and making referrals to other professionals, learning new assessments in the manuals, completing CEUs in areas they need or want to grow in. And success for a new therapist is defined by the ability to effectively manage their caseload and meet all the documentation requirements, provide high quality services that result in positive feedback from patients and families, collaborate well with the therapy team and other service providers, and demonstrate clear professional communication with all stakeholders. So sorry, that was a mouthful and I read it, but I really didn't want to pick and choose some of the comments from it. I wanted you to see them as a whole because I felt like they were so rich and so thoughtful and so detailed. And these are the people here that you can thank for contributing their time and their thoughtfulness and their candor to these answers. You can see they are all a wide variety of professions throughout our therapy world. I'm going to stop sharing and let's talk a little bit about thoughts, comments, surprises, where to go from here, suggestions. Anyone?
I don't remember exactly what the ones were, but I totally agreed with Taylor that like some of those like concerns or shortcomings were like, wow, I don't, it almost kind of confirms things that I was like, maybe I think this is bad, but maybe it's not that bad. And then it's like, no, it is that bad. And I would have to look at the list again, but it is almost interesting to me how it definitely felt like the positive ones were more maybe personality based, like personal characteristics that people had. And then the shortcomings or the negative side were like maybe just more soft skills and then some hard skills. So I don't know. I guess there's hope in that like we can work on these things. These things can be taught. And then, you know, for the positive things, if you already, you know, have these positive characteristics, good for you.
Yeah, you're halfway there. And I will also say that if I was to probably survey hiring managers that had therapists that have worked there for the last 10 years or 20 years or have a wealth of experience, what are their complaints? They would still have them. You know, we all have them, and we all have areas that we can grow and areas that we can improve on. This was, you know, just asked in this specific area. And again, I think PTs and SLPs do think a little bit differently from OTs. So they're all kind of lumped in together. And I think, you know, especially some of those answers, I think were, you know, the PT, some of the PT types of things, especially with the doctoral, the mandated doctoral and things like that. So thank you for sharing though, Rachel. Anybody else?
I oh,
Yes, Taylor, go ahead.
I just wanted to add, well, first of all, thank you for all this information. Like I was sitting here thinking, oh, I'm going to share this to all of my students when I go back to work tomorrow. And for people on the call, I work in academia also, so I can kind of offer that perspective. And I'm the fieldwork coordinator, so I feel like there's a lot of overarching layers here. But something that I want to encourage everyone here with, either if you're a student or if you do have a mentor, is that when feedback is provided, that often it does come from a place of love. And I've been on the receiving end of feedback where it might have felt personal. And truthfully, if someone is having that conversation with you about skills you need to like grow in, or areas that could just use a little bit more love, I would encourage you not to take it personally, as hard as that might be, and really reflect and think, okay, somebody who cares about my well-being, cares about my growth as a future clinician or as a current clinician is sharing this with me. Let me reflect on it and see, like, what do I agree with? What maybe do I not agree with? And so I think a lot of, which is really why I said, you know, this feedback is interesting that they shared, because it's very direct, and I can see where, as a student talking with your advisor or any professor or maybe a mentee with a mentor, if you are on the receiving end of that feedback, it may not feel great, but that's growth happens, right? Growth happens in the weeds. And again, it's not personal. Sorry, that's kind of a rambling, but I really do, you know, it's hard to give that kind of feedback. I have been in the situation of giving that feedback, but it does often come from a place of love. So if you get that, just know that it's, I've told my students, like, I would rather you hear it from me, right, than for me not to tell you or ignore it. And then you go out on fieldwork, or then you go into your job, and then someone else says it to you in not a pleasant way or a way that encourages growth. And so just, that's my 2 cents.
Thank you. I appreciate it. I was going to ask you specifically, Taylor, what your thoughts were in being in academia and an academic fieldwork coordinator. So I appreciate that. And it's hard on both sides to give feedback as well as to receive feedback. Yeah, it's hard on both sides. So, and Jenny mentioned in her comment, she wonders if the age or generations of the staff created like a different type of critique with the answers. So that's interesting. That wasn't anything that I asked them on how much, how long they had been practicing or any age ranges or anything like that. So that would be interesting as well. What other thoughts or questions or talking points does anybody else have?
I'll jump in. Oh, go ahead.
No, you can speak. It's fine.
I was just going to say some of those skills that they mentioned that were challenges or kind of those negative skills is a great point on mentorship. Even if it's not through our mentorship program, just having a mentor in that new job setting can kind of help you through some of those skills that you're struggling with, some of that time management, the communication, addressing conflict. A mentor can kind of talk you through, help you with all of those things to build those skills in your practice.
That's a great point. And, TNOTA makes it easy by offering mentorship through our organization. And you can also do it, through your workplace even, and you can get continuing education hours for serving as a mentor. I had done that before the mentorship committee had started using like the AOTA guidelines. So yeah. Thank you for sharing, Logan.
Yep.
Next, who is our next commenter?
It was me, Samaria.
Oh, thank you.
I really like what Miss Taylor, well, Dr. Taylor, I don't know.
Dr. Cozell, yeah.
Okay,
And
Dr.
but she
Cazell.
yes.
Yes.
Me too.
Okay, Dr. Cazell. I love what she said about the feedback, because I feel like when it comes to feedback, I think establishing good rapport maybe with like the new incoming graduates coming in will be good when it comes to like them feeling like they can ask questions. So I really think that was a really good thing to talk about when it comes to like feedback. So like I think feedback can kind of goes different ways, because you don't know if it's like a they're like talking like bad about you or anything, but I know it's like coming from a good, like you said, place of love. So that's a
Yes.
really good thing. Yes.
Yeah, good. What program are you with?
University of Tennessee Health Sciences Center, the math.
Oh, yeah.
Yes,
Okay.
ma'am.
I'll see you in a few months.
Oh, for real? Okay.
Yes. Any other thoughts or comments?
Jennifer, I really enjoyed this information a lot. Did note one thing that I particularly loved, and just from my experience of working in various settings, I love that you gathered this information from OT, PTs, and SLPs, because I've been on the end of trying to be hired, and I'm not interviewing with an OT. I'm interviewing with another discipline. And so I think that can happen probably more often in your outpatient settings, perhaps, and then in like skilled nursing facilities and inpatient rehab, and even in hospital settings, because it's a wide variety. You're not sure which discipline. So I think it's so important to see these different perspectives of those hiring managers, because they are a little bit different, even though we have ingrained in us our OT skills, abilities, and what's really honed in on in OT school, but other professions have a little different variation of that. So I just really appreciated seeing that difference between all three disciplines.
Good. And it would have been super interesting to hear, like, this is what the PT said, this is what the OT said, and this is what the SLP said. But I think that would have taken away from some of the candor and the honesty and things like that. And my group was so small, I didn't want to identify anybody specifically with their answers. But yeah, and Taylor agrees with you, Morgan. Yeah. What other thoughts or questions? Anybody else from the mentorship committee have anything that stood out to them, or things that resonated with them in receiving mentorship? Any common themes? All right. And Amanda says she has a background in an acute care trauma center and served as a team leader during our interviews. Confidence was great, but overconfidence was concerning. I think we hear fake it till you make it, but some things it's not appropriate or safe to fake. That's a great point. Most OTs love mentoring and helping, and being open to growth is best. Yes, that's great. And I think the common theme here, I didn't hear anybody say a complaint as being people ask too many questions. Nobody gave that as an answer. They were encouraging their new hires new employees, new graduates to ask questions and to communicate. So I think that's a great point to take. And especially if it's something that concerns, patient safety, those types of things, you 100% have to ask questions, get clarification. Where else can what other resources do you have that you can support me in this? Asking for those types of feedback and help. Anybody else? Any ideas on where to take this topic from here?
I think
Any other?
it should get an IRB approval.
Ooh, I don't know if I was going that far. I think this can definitely lead into some other things, and it would be great, like at TNOTA, to have hiring managers there for a panel or something like that for people to ask and engage in questions and answers and things like that.
Jennifer, I have an idea that maybe I'll throw out there if you're willing to take suggestions on where to go next. So
Uh-huh.
I was thinking mock interviews, and you could do that as part of maybe the student lounge or just a student event at conference. If you could get some hiring managers, it could be.
That was a topic in one of the conference planning committees. That's was one of the things that were brought up, and I think that would be very beneficial. And I don't think just students would attend that. I also think that practitioners would find that valuable. That would be a great stepping point from that. Jenny also mentioned to compare the negative critiques with their length of employment. Yeah. Very interesting. Any other thoughts or questions or any other feedback on this? I'm glad that we were allowed a few minutes to talk to and to kind of share and to hear some different sides, different input from students, as well as some of the practitioners that we have on the call. So I think that was very valuable, as well as some people in academia. I feel like that's all been beneficial. Any other thoughts?
I have one other thought that came to mind as a stepping stone too, Jennifer. So I think this will help. It depends on what setting that you are in, but for instance, in the setting that I'm in, I have to write a mid-year review and a yearly review for myself to turn in that is then reviewed by my manager. And then that goes towards my overall raise for the year. And then, it's filed in HR. So just really putting together a way to self-evaluate, I think could be really helpful for not only just for those instances when you have to do it for your employer, but also for a self-reflection.
Yeah, that's a great point. And I was talking to a colleague not too long ago, and she was saying how for her annual performance review, she has to set goals for herself. And some of these topics would be great goals, a great stepping point for making a really good goal for oneself. So, and Logan has also put in the chat the mentorship program information. So don't forget about this. Whether you are a seasoned practitioner, they could use you on the mentorship side, or a student right now, maybe you're on your rotations, about to graduate, or maybe you've just started. Just keep that in mind that TNOTA has that wonderful resource with the mentorship program. So feel free to look at some more information on that and keep that in the back of your mind. There's some great practitioners that are on the mentoring side of that. So definitely take advantage of that. As part of your TNOTA benefits. I want to thank Morgan for her help with this presentation. I want to thank Logan also for her help on the mentorship committee side. Taylor Kozel, thank you on the student involvement committee side. Thank you all for being here. We made it through without any tornado warnings or Wi-Fi glitches or anything like that. So I appreciate everyone's participation and attendance tonight, and hopefully you leave with some great ideas and thoughts on how to help prepare for your next job interview or job search. Good night, everybody.
Thank you, Jennifer, for hosting and putting this together for us.
Thank you.
Thank you, Jennifer.
Thank you. Good night, everybody.
Thank you.